Good evening, Dr. Lang and Kaiser students. My name is Erin Lambert, and I wrote a persuasive speech on how to stop smoking. Now, I know many of us may deal with this addiction or have watched family members deal with this addiction, and I know it's not easy, but I want to take this time and just talk about a few topics that are close to me and what my family has gone through. The central idea of this speech is to discuss the reasons behind nicotine addiction, how smoking affects one's health, and lastly, how smoking while pregnant can cause harm to a newborn baby. Each day, more than 32,000 people under 18 smoke their first cigarette, and 2,100 of them become daily smokers according to the U.S. Department of Health and Human Services. Every puff of a cigarette really does take a little from one's health and well-being. We as young people need to understand exactly how harmful nicotine is to our well-being, and even though it is socially accepted and portrayed as being okay, it's not in the long run. We make choices every day that we don't know the outcome of, that may affect us in our health or well-being. Don't let the one thing we do know the outcome affect us even more, and affect our future, and our health, and our future family. I've watched my family members smoke, some starting from as young as 13 years old. My grandmother's life was taken from her at stage 4 lung cancer, which spread to her bones and then lastly her brain before taking her life. It was sad and it was hard to watch her go through this, and especially being in denial, her thinking that smoking didn't cause that. Well, when you smoke almost 2 packs a day, you're increasing your chances of getting some form of cancer eventually. My father also has smoked over 50 years and has, in the last 4 years, had bladder cancer 3 times. Luckily, no scene or no founding of lung cancer has been found, so we're thankful for that. Cigarettes themselves are not what is addicting. What many may not know is that nicotine and the other chemicals inside are what will increase your chance of killing you, which are more than 20 million Americans since 1964, according to HHS. How can smoking cigarettes become addicting, you may ask? Most smoking is done because it's nicotine that becomes addictive. We hear a lot of times that smoking, or people that do smoke, they feel relieved or less stressed when they do smoke, and they pick up the cigarette because of their stressful situations, lifestyle, or whatever it may be. Research has found that that is because nicotine acts on the brain and releases the feeling of euphoria or pleasure. A key brain chemical involved in mediation, the desire to consume drugs, is a neurotransmitter dopamine, and research has shown that nicotine increases the levels of dopamine that the body produces, according to the National Institute of Health. Dopamine is released in the brain, reason many assume that it relieves their stress. Using advanced neuroimaging technology, scientists have seen a dramatic effect of cigarette smoking on the brain and the body, and are finding a marked increase in the levels of monoamine oxidase. It is an important enzyme that is responsible for the breakdown of our dopamine in our brain. Non-smokers have a good enzyme level in their lungs, their heart, their liver, and kidneys, but someone that does smoke, a daily smoker, has reduced enzyme levels, reason they feel stressed. The effect nicotine has on those who smoke versus those that don't is greatly noticeable. If ingested in large amounts, it increases the risk of problems with one's health, but has no show of cancer, and that is nicotine. Cancer is caused by other products or chemicals in a cigarette other than nicotine, such as tar, formaldehyde, cyanide, and ammonia. Those are just a few of what is in that little teeny tiny of a cigarette. Those 4 elements that I just talked about are grouped together to known as carcinogens, which carcinogens is defined as a cancer-causing element. There are others that are inside this cigarette: butane, which is lighter fluid. What are the odds that there's lighter fluid in it that we have to light it? Paint chemicals. Formaldehyde. Formaldehyde is something that preserves dead animals or any kind of being that needs to be preserved for a long amount of time. Bleach. You think about the things that are ingested in a cigarette, and not only is someone just smoking one, they're smoking sometimes 2-3 packs a day. So that's a lot of chemicals and harmful agents that we're putting into our body. And if we picked up a bottle of bleach, it would say do not ingest. Anything of these would say do not ingest. So what are we doing to our bodies? Smoking not only is bad for you, but is perceived as being cool or the grown-up thing to do. Adults and parents teach by example. As children, we look up to our parents. I'm fortunate enough to never have picked up the habit, but I hated it because I think my mom hated it. My mom hated the fact that my dad smoked, and it was something that they just dealt with. And even though my father attempted many, many times to stop smoking, it was very, very difficult for him. When thinking about the consequences of a long-term smoker or that smoking has in the body, most may automatically think cancer, lung cancer. That's what I would have thought. But what about the other parts of our body that go through the changes? Minor health issues from smoking are sometimes overlooked. Halitosis, bad breath, it's a common factor. Wrinkles around the mouth, in the eyes. We see that a lot in young people, and they're premature aging themselves. They're changing their look before their time, and it's not, honestly, gracefully. They're yellowing of teeth. A lot of people hate it. There's commercials every day. Whiten your teeth, have a bright white smile. Smoking, number one contributor to yellowing teeth. Major health concerns from smoking can seem to be harmless until more than one cigarette has to be smoked to get that euphoric feeling and release their stress feeling. It then becomes an addiction where they have to smoke more than one and continue to smoking to get that same feeling, which now they've honestly built a tolerance, and that is when it's defined as an addiction, is when they can't go more than a day without having their cigarettes because their stress is building up and they have no other way to get rid of it as they feel. Gum disease and tooth decay are major health concerns that our body does not need to go through as long as we don't smoke. Yes, there are other factors that may bring these issues, but smoking brings at the top. There's a condition called Raynaud's phenomenon, which is the bluing or whitening of the fingertips when they become cold. It is because over time we use the cigarette to smoke. We're burning the layers of our skin. We're burning nerves. And it also, over time, we're damaging the tissues around our fingers that aid in the circulation to keep our blood flow there. And when there's no oxygen, blood flow, they do seem to be getting cold, and they will have a blue or white tint to them. If continuing to smoke and not take care of the body that we have, a lot of these health issues can worsen and lead eventually to death. Lung, bladder, and blood cancer are all stemmed from long-term smoking. We don't hear too much about blood cancer, but it's there. Heart disease, coronary artery disease, lung disease, COPD, emphysema. Our lung may even collapse. These are all things that can happen if continuing to smoke over time, and eventually, none of us want to talk about it, it could lead to death. How can smoking affect my unborn child? Complications during the pregnancy, low birth weight, and immunity and cognitive issues that may affect the baby. We'll start back at complications. Stillbirths or death within the first week of birth are increased to more than 1/3% if the mother was smoking during her pregnancy. Miscarriages are seen more often in mothers than others that don't smoke. Low birth weight. Premature babies are usually the result of smoking during a pregnancy. Or babies born to women who are smoking on average are 8 ounces smaller than a baby born from a non-smoking mother. And that was found on a patient blog about smoking. Immunity and cognitive issues that may affect the baby. The child may have to show a slight lower reading and math skills than others. Higher chances of developing asthma, actually. Their immunity systems aren't fully developed, and they may seem to get sick more than others. After researching everything, it's made me want to get out there and show pictures of children and individuals that are suffering from a habit such as cigarette smoke. We don't think that something so little as a cigarette and smoking it so quickly can affect our body in such a grand scale. We live in a day and time where fitness and health are booming, and everyone wants to be at their top. They want to show their bodies off, and they want to be the best they can be. And then all of a sudden you see them light a cigarette, and you're like, what? Why would you want to put all that work into making your body tip-top 100% and then put harmful chemicals inside that are deteriorating and destroying everything that you're building to be the best? It doesn't make sense to me, but I know just because I don't smoke, I can't say I don't understand, because watching family members struggle to quit, my heart goes out to them, because a non-smoker, such myself, would say, it's easy, just quit. But no, it's more than that. Just by smoking, we're opening the door for addiction to creep up and overtake our health, our future, our children's health. No matter who you are, it's never easy to kick the habit. But it is possible. There are many treatments out there and support groups. Don't limit yourself. Don't give up too soon. Write a list of the things that are most important to you. Keep a journal of how many days you've gone without smoking a cigarette, or decrease the cigarette use. Tell all your friends and family. Make them accountability partners to keep you proactive on quitting. If this is where your heart is, please stop. Because in the end, it's totally worth it. It's worth giving you an extra 5, 10, 15, maybe 20 years of life if you quit now. Also, imagine all the money you would save. Instead of buying one pack of cigarette that is around $6 to $7, depending on what brand you buy, you may be able to buy that boat or that car or maybe even that house, or go on that great vacation that you've always wanted to if you put that money aside. Here's some health benefits after your initial last cigarette, or when you quit smoking. 72 hours after, your breathing becomes easier. Your bronchial tubes open and relax, and the energy levels increase, giving you more ability to breathe. 1 month, your skin improves, owing to improved skin perfusion. Wrinkles may go away. Elasticity in the skin may become better. 3 to 9 months, that cough, that wheezing, those breathing problems are improved. Lung function increases by 10 or more percent. A year after not smoking, risk of a heart attack falls to about half of that of a smoker. That is a lot. That's only after 1 year. Imagine what you could have done in 1 year, or the money you could have saved. 10 years after not smoking a cigarette, your risk of lung cancer falls to about half of a smoker. That's amazing. In 15 years, risk of heart attack falls on the same level that would be for someone who has never smoked a cigarette once. That was found also on the blog Patience in 2015. All these references mostly came from National Institute of Drug Abuse, U.S. Department of Health and Human Services, the Veterans Affairs, and a couple blogs that I researched. There's so much out there for people that want to stop and change their life around and stop smoking. There are helplines. There are people that you can talk to. if you can't give up that cigarette that one time, there are patches, there's gum. They even recommend e-cigarettes. I don't know too much about them, but they may work if they work for other people. Not everyone's the same, but if your heart is willing, definitely give it a chance. And definitely give yourself extra money, extra time with family, and a better lifestyle. Your heart and lungs will definitely thank you one day, and so will your family. So I hope this speech persuaded someone to stop smoking or to not smoke ever, especially if you want to live a good life. I'm not saying that people that do smoke don't live good lives, they do. But if your health is a major concern to you, definitely keep this in mind. Okay, I hope you guys have a good night. Thank you, Dr. Lang.